welcome to us in Resilience Matters series. Today I'm delighted to be joined by Lindsay Smith, who's a health and wellbeing workplace consultant and therapist. And Lindsay and I have met at a number of events recently, and is amazing, really colourful background. Love listening to you, Lindsay. And at a recent chat, we were talking about this ISO for 45,003 and 3. And actually, I'd never heard of it. So I thought, what a great thing, for our network to find out a bit more about. And, they're really serious about, supporting their people in mental health, and what a great resource to have. So that's my background on you. And so it's been fascinating, our chats recently. So can't wait to share it with the world. So tell everybody about yourself, Lindsay.
All right. So from my accent, you can tell that I am not from England, although I am British by heritage. So I come from South Africa, and I did most of my education in South Africa, my professional education, but then came over to the UK 9 years ago and did a master's degree in workplace health and wellbeing at Nottingham University. Woohoo! Still going strong there. So I have been a workplace health and wellbeing consultant for many years, many years, and ran my own business in South Africa, have a consultancy here in the UK, and offer workplace programs for businesses. And when you say ISO 45003, it's like a whole system, but organizations can pick and choose which parts of the system that they need. And they can look at, do I have a gap in this area or do I not? So it's not this hard and fast thing that you've got to have every single component. But we'll talk about that when you ask me some questions about the standard, when you want to know a little more about it.
Well, it sounds like a good place to start, actually, Lindsay. So what is ISO 45003 and what does it give businesses?
Okay, so for the word ISO is International Standards Organization. It's actually International Organization of Standardization, but the acronym is ISO. And the numbers are the numbers that they give to every standard that they develop. And then they put a year at the end of it, which tells you what year the standard was actually published. So this standard is a brand new standard. It was published in June of last year. And it's had more than 40 countries with specialists in this particular area of workplace stress and mental health that got together to develop the standard. And the UK had two specialists on that standards developing committee, they call it. Call it a technical committee. And so it was published in June 2021. So it's very, very new. A lot of companies don't know anything about it. And so that's what I'm here to tell you about, a little bit about the standard. So what would you like to know, Kathy?
Yeah. Well, to be honest, I was quite surprised. I'd never heard of it. So, so has there been much uptake, or like you say, has it just been that people aren't aware it's there at the moment?
I think that a lot of people are not aware that it is there. But it was launched into an environment where companies are very, very interested in taking care of the mental health of their employees. And that follows COVID. But if we look at our national statistics, we were in serious trouble in terms of mental health before COVID. But I think what COVID did was brought it to front of mind for businesses, because there was so much, people saying, I am so stressed. My mental health is not very good. Sorry, my emails just popped up on there. So it's really a good time for the standard to have been launched, because companies are so interested now in looking at, well, what can we do to safeguard the mental health and well-being of our employees? So that's really what it's about. But it uses a bit of a mouthful of language. So it's called the Standard for Psychological Health and Safety at Work. And it's a guideline for, and here comes the big word, for psychosocial risks. And the people who were on that technical committee very, very specifically decided to utilize that word. psychosocial risks, because it's not just about the person. It's not about the psyche. It's also about what is the culture of the work? What is the culture of the workplace? And I think that that's a good starting point to talk about what the standard is about. Most companies think that if they offer some stuff to their employees, that it's up to the employees to look after their mental health. So I can give you some examples. And you are known as the resilience girls, you and your partner. So a lot of companies will hire you and do some resilience training, and they think, yeah, we've ticked that box. You know, our employees are now going to be very resilient and they'll be able to withstand stress. But we all know that if you've been given resilience training and then the stress comes along and it's constant on you, you're not going to be able to stand with that. So what the standard forces businesses to do is to do a risk assessment and to look at themselves as an organization to see what kind of stress are they putting on their employees.
Yeah.
So that's an intro.
Yeah, and do you know what? That's the bit that really intrigued me when we talked, because I completely agree. You know, I think a lot of people on the call will recognise, oh, COVID, come on, let's have a yoga day, let's do a bit of bowling, or whatever it is. You know, let's do some, like, you know, and we've got a lot involved in a lot of those live webinars and lunch and learns and things. But actually, there's the leadership and there's the culture and the psychological safety and all the things around that ecosystem. That's just one point. Yes. And that's what really intrigued me, and I laughed about what you spoke about. So you say the company, you know, is that split into specifics like culture, leaders, or how what sort of things do they look at?
Well, every single company has got a culture. So let's use an example of, so, you know, I'm a therapist, so I have, I do 1 day a week, I do therapy as well. And so I had a client who had so much stress at work and was working so many hours, long hours, had 3 young children. And he just decided, I'm not going to work like this any longer, I'm just going to leave. And he left his job. I asked him, did you ever speak to your upline manager? And did you ever go to HR? Did you have an exit interview? And he said, well, why should I speak to my manager? Because I log my hours every single day. And my manager can see how much overtime I'm working. So that's the first thing, is that he expected that the manager was looking at everyone in the team's overtime. And managers are so busy with their own work that possibly didn't have enough time to look at that. So that's one instance that perhaps the manager did not have time to look at that overtime. But he left the company without an exit interview. So that company, whether it is a good company or a bad company, nobody at this point knows, because nobody knew that this man was not coping because of the overtime that he was working. And so what the standard does is it says that the company needs to do a risk assessment. So they would have to look at how many hours are our people working. So for example, if everybody has been employed to work 37.5 hours per week, and they're working 45 to 50 hours per week, there is something wrong. And the company is the one that is putting the stress on the people. It's not got, so you couldn't do a lovely resilience training with that person because they're still working too long. It's not working for them. So that was a culture of the company that long hours is just an acceptable thing. I have another young lady who came for stress at work, therapy, and also thinking about leaving because she is a supervisor of a team, and her team members come along to work at 7 o'clock in the morning and they leave like at 5 to 6 o'clock in the evening. Now, this young lady has got a baby and she had to collect the baby from the childminder. So she was feeling incredible stress because she was leaving a team who had already started earlier than she had and were leaving later than she had, that she was. And so can you see that in that culture, and her upline manager said to her that, well, if you want to get ahead in this company, you have to work long hours. You have to put in the time. And so can you hear that that's a cultural thing? It's an accepted thing.
Totally.
And so...
Yeah. And we hear a lot, actually, where people say, actually, my boss is going, no, don't worry, you go home, or you don't have to come in the office, I will, though. And it's not being a role model, because if you've got your boss sitting there working long hours or in the office, or worse still, and I found this even as part-time before all of this, is that, you know, your objectives are no different, your deliverables are no different. So unless you do the hours, it's not going to happen. And then you feel like you're failing. So I totally get that. And do you think then that's, I understand it's the company culture, but do you think that's a leadership? I mean, you spoke about a supervisor there. You know, does it come from the top to set that tone? Because you would hope from the top that they would be setting that tone in that environment. Well, I guess does the standard then, because you are having to look at some of these metrics and some of these key indicators, it's flagging them, hey guys, this is a risk, this is what's happening, because maybe they don't even know.
Yeah, exactly. So that's exactly what the standard does. So the standard has to be brought in by top management because it costs them money, because they have to do a risk assessment. And for anyone who's listening, the standard requires for you to do a risk assessment, but hey, so does the Occupational Health and Safety. You know, the Health and Safety at Work Act also requires you to do a risk assessment on health and safety. And this particular standard looks at psychological health and safety. It doesn't look at physical health and safety. So companies are very familiar with looking at health and safety, but they kind of don't really know how to measure psychological risks. So the standard tells them exactly how to do it. Or it doesn't tell them how to do it, it tells them what to measure, what to look at. So it lists all of the risks that create psychological injury in the document. And it divides them up into 3 different categories. So I will tell you what the categories are. The first category is around how work is organized. So what I was just talking about overwork or long hours, that is about how work is organized. The second factor is about social factors. So how much support do you get from management? How well do you get on with your colleagues? Do you feel supported by HR, or is there an EAP program within the organization that you can access support from? So it's all about support and social factors. Is there bullying in the workplace? And if there is bullying in the workplace, what do our policies and procedures say around stopping that our company will not stand for it, that kind of thing. And then the last one is about work environment. So does your work give you what you need to do your job successfully, and does it protect you in that? So for example, let me think of an example. I recently went into a psychiatric hospital where they had very, very, very violent patients. And just for those of you that think that people who have mental illness are very violent, it's not the case. But in this particular hospital, it was for people with learning disabilities as well as mental health problems. And the people who were working with that group of patients had all been injured, all of them. And so that was an unsafe environment for them. And so what that said was that there were not enough people to look after such violent people. So they needed to have 2 or 3 people looking after the one person instead of one person, and that kind of thing. So it's about, does your work give you what you need to remain safe within your work?
And when you say safe, I mean, I guess, you know, that talks about a physical, you know, being physically safe. What about that psychological safety? Is that included in that?
Well, that's what I was talking about. I was not specifically talking about the physical safety. Can you imagine going to work with fear every day?
Yeah.
Fear that I might be assaulted, fear that, you know, my patient might get loose or run away. So it's living with the fear of the unknown. So we're very specifically talking about psychological injury and psychological safety, not physical. Another example that I can think of is when COVID first came in, people were terrified of COVID, absolutely terrified. And I'll give you an example of what happened. A young man had gone to Spain or Italy on a business trip, and he had come back with flu. And all the news was all about, I can't remember if it was Spain or Italy, having such high COVID, infection rates. And he came back and he was reporting to his boss, and he had flu, and he was coughing and sneezing and spluttering, and he was so excited about the work that he had done in Europe. And she was backing away, because she was terrified that he was going to give her COVID. Now, we didn't know much about COVID at all in those days. We were just hearing about all these deaths that were occurring in Europe. And eventually she screamed at him and she said, "Get away from me, get away from me," because she was so terrified. And he went and he sat by himself and just closed down. And the next day, lockdown came. The very next day after that had occurred. And because she was so terrified, she didn't make contact with him. She didn't check in to see how he was. And he did have COVID. And so he felt really isolated and really, really abandoned by the company because they had sent him over there. And so when he recovered, he did recover. He just left the company because he felt unsupported and uncared for in this terrible crisis. But she herself felt like she was very unsafe, from him coming closer to him. So it's those kinds of things that we speak about. It's about the culture. It's about what drives fear and stress and anxiety. Is it the business that is driving it, and the systems in the business and how work is organized, rather than putting the focus on the employee and saying, you need to go for counseling, you need to be resilient, you need to be strong. And it's looking also at the organization and what are they doing.
And I love the fact that he's an ecosystem. And I guess when you talk about that, I thought of a few examples that I knew in early days, and I can see that psychological safety. How does it address? So you might have a really brilliant organisation, especially when you've got big companies, right? We've got these big corporates, big firms, great organisations to work for, but it's run by people, right? And we're not perfect. So you might have a manager where you're not psychologically safe, but actually on trend as a business, it's all great. It's got all the policies in place. How does that call out bad management or where people are fearful in in buckets, if you like, in the patterns of behaviour?
Yeah. Well, so that's why you've got to have a risk assessment. And the risk assessment will pick those things up. So it's all done online. It is completely anonymous. But all employees can answer the risk assessment online. We get the data, we analyze the data, and we can. So if there are more than 8 people in a department, we can then anonymize the data. But if there are less, we can't. We'll then join two departments together so that nobody is picked up. They can maintain their anonymity. But we can very, very well pick up that, this particular department, there's lots and lots of overtime happening here. This particular department over here, we can see that there's a high staff turnover. So what's going on over there? At this particular department, we can see there's lots of absenteeism. So when you do the risk assessment, you can clearly pick up on when things are wrong. And that's when you will look at, well, what actually is wrong? What's going on and what's the dynamic in that particular department or that particular branch of the company? And once you've identified what the problem is, so let's say it is a manager who does not know how to treat his department very well, and he puts a lot of stress on them. So the HSE has designed a very, very good competency tool specifically for stress, and it is freely available on the internet. So anyone who is listening can actually go to the HSE's website, look for their stress management sort of section, and you will find the management competency tool there. And it gives great advice. So the manager would fill it in themselves. and it would tell them what areas in their management styles they need to actually work on. So there are so many things that we can do that will help managers to improve. The other thing that I can think of is that managers need to do a psychological check-in with their staff. So when they have their meetings, just checking in to find out, well, how is everybody? And if anybody is feeling stressed, to ask if they would like to have a private conversation. And when they have that private conversation, they could introduce a tool called a WAP. Have you heard of a WAP?
No.
No? So it's a wellness action plan.
Mm-hmm.
So it's a conversation between the employee and the manager. And it asks the questions about how can the manager help the employee to reduce the amount of stress that they're experiencing in the workplace. And if they already have a mental health issue, how best the manager can support them with that particular issue. So you can see that within the ISO system, there are so many components that can be put in that will help to reduce the stress from the organization's point of view and not leave all of the responsibility to the employee.
Definitely. And you know, I firmly believe nobody comes to work to do a bad job. So even those leaders, you know, it might be a blind spot. They might not even realise, you know, that their team may feel like this. And it's amazing that you have, so obviously look at the process and the systems, but also the individual surveys, you know, a bit like an engagement survey to actually understand where those hot spots are. But what I really like there is this competency model, because we wrote a white paper around mindset, and managers said to us they don't like, you know, it was nice it's something formal like a WEP, you know, to give them that, because they found difficult to ask people how they were doing, because if it activated a negative response, they didn't feel equipped to have conversation.
Yeah.
And obviously we tell people just have a conversation, check, you know, how you're feeling, you know, empathize, you know, be objective, don't judge it, just listen. But so to have some kind of toolkit, freely available, sounds amazing, because I know that's an issue for some leaders. And it's not that we're not necessarily, we're nervous, aren't we, about responses like that. So I think that would really help managers.
Yeah, it really, really does, because it gives them a tool. And so you can actually give the tool to the employee, and you can say, well, you fill this tool in, and then when you come back, we'll have a discussion around the tool. And so then the employee is then leading the conversation about, this is how I'm feeling, this is what I would like support with. And then the manager can respond about whether they can give that kind of support within the team, or if they feel like they need to signpost the person to go perhaps to EAP, perhaps to occupational health, if they do have it. And if they don't have any of those services in the workplace, then perhaps to contact the GP, to be referred into the NHS counselling system, or to access counselling privately. But the manager would then be able to say, you know, I can't manage this. Let's look for some extra help.
Yeah.
But you mentioned competency, Kathy, a little bit earlier on. So the standard requires competency with various people. So top management have to lead the system. And then line managers have to be competent to not stress their team members. So it's part of the system. So the system then requires, if they're not competent, they need training. So one of the things one of the trainings that is done right throughout the organization is basic mental health awareness. So what it is, what it is not, how to treat people who have already been diagnosed with a mental illness, how to watch out to see if they're escalating, and what to do with them if they are escalating or not coping. And instead of just keeping quiet about those kinds of things. Of course, you're going to have some people who have got mental illness who don't want to talk about it, who are very, very private about it, and that's their business. But it still needs to be managed very empathetically and very sensitively.
Yeah, totally. So I'm just thinking, so if I'm a leader now, or I'm working in an organisation where I really want to, you know, I've done all the team bonding. I've tried to training. I've got mental health first aiders, but actually they feel there's more to do, and they're really interested in this. But what would be next for them? What could they do?
Okay, so there is a maturity model. So when we look at the maturity model, what we find is that companies who are immature in the model, or who just simply don't understand, they place the responsibility on the on the employee. So they will give them the yoga days and massage days and really, really, nice things, and provide EAP, etc., etc. But with any kind of risk in the workplace, there needs to be a risk assessment. So anybody who's truly interested in reducing the psychosocial hazards in the workplace, they have to do a risk assessment to determine what the risks actually are. And Kathy, you spoke about an engagement survey. And in terms of risk, that is not a risk assessment, because it doesn't measure the severity of something. It doesn't measure the time span of how long that has been going on, and it doesn't measure the frequency. And so those are the things that we know will bring about stress within an employee. It also doesn't do a comparison. So let's say, for example, I work long hours, but I have great support from my management, and I have a wonderful working environment. I have great support from my colleagues. Then I am less likely to become ill from my stress than somebody who's working long hours, has no support from management, and perhaps works isolated with no contact with their colleagues. So you can see you've got to measure the risk, because you cannot say one thing standing alone is going to cause that person to become ill.
No.
So it's all very scientifically worked out. It's not just my people are happy, I've done an engagement survey, they get on with the manager, or they like the work that they're doing. It's not about that. It's actually doing this psychosocial risk assessment. And the standard is very, very clear on what risks need to be assessed. So it was those 3 areas that I told you about that have to be risk assessed.
Yeah. And do they get a consultant in like yourself? Do they do it in-house?
Yeah.
How do they do that?
I don't think that there are enough people in-house that have actually know about the standard yet. So mostly they will get some consultants in. So if we speak about occupational health and safety, physical occupational health and safety, most people have got an occupational health and safety manager. Yes. And that manager, when they first start implementing the system, they will get consultants in to help them to set up the system. And once the system is kind of maturing, they can manage most of it themselves. But they will still get researchers to come in and do the risk assessments and to give them reports, and they will still get auditors from an outside consulting organization to come and do the audit. So it's exactly the same as any kind of ISO standard, is that sometimes you'll need a consultant and sometimes you won't. It depends on how much capacity you've got within your workplace.
Yeah, fantastic. Well, as I say, it's fascinating. I thought it was fascinating the first time we briefly talked about it. It's even more fascinating now. And I think, in a world where we do want to retain our talent, where we're trying to attract the very best talent into our organisations, I think, what a great value proposition, employee value proposition to offer as well. I think if I was working for one organisation with that standard, I would feel I was being taken seriously, that my mental health as well as my physical health is safeguarded. So thank you so much for sharing with everybody on LinkedIn. As I said, I think it's fascinating. I'm sure that people like myself had no idea this even existed. So
so you asked how much time do we have left, Kathy?
Very short on time. We're coming up to 30 minutes.
Okay, we have. Oh gosh, there's so much. So just when you said what can a company do, I said a risk assessment, but it doesn't happen by itself. So usually you would set up a working team or a committee. Once top management have decided we're going to do it, you get together your committee will then develop a plan. And number one in the plan is doing the risk assessment, and everything else is based on that risk assessment.
Yeah. So you're spending your energy on the areas that you should, rather than wholly. Yeah. Which makes sense, right? So yeah, it's not a tick box. It's after the risk assessment, this is where we're going to focus on energy, and this is what we're going to do.
Yeah.
Now, it's fascinating. Thank you, Lindsay. And as you're chatting, I did actually look up the address. So actually, if people do want to look at resources there, and obviously Lindsay is a great resource to have as well. When it's on LinkedIn, I'll make sure that you're linked into that in the feed. So please do reach out to Lindsay. But lovely speaking to you.
And you, Kathy, thank you so much.
And just to close off, obviously we're always looking for interesting speakers that will inspire people, that will give us new perspective, as Lindsay has today. So if you would like to be part of Resilience Matters series, or got something to share, please reach out to myself, Alison Burgess, at i'vegottthis.co.uk. On that website as well, we do have lots of free resources as well. Please feel free to use them. 101 ways to build mental strength, self-diagnostics. So again, it's all free, freely available to people. So I will leave you with that. But until we chat again and you give me some other gem, Lindsay, that I feel like we will share in the world, it's lovely chatting to you.
And you. Thank you so much.
Take care. See you later.
Cheers. Bye.